Britain has experienced the fastest rise in health and disability benefit claims among developed nations, according to an analysis by the Institute for Fiscal Studies, IFS. The share of the working-age population receiving these benefits increased by over 25% from 2019 to 2023, outpacing other countries like Denmark and France. The financial burden has also grown, with spending on these benefits soaring 50% from £37 billion before the pandemic to £56.9 billion in the current financial year. Health-related benefits now make up 40% of all working-age welfare spending, compared to 22% in 2010. Tom Waters of the IFS noted that the UK's spending on health benefits as a share of GDP is not unusual, but the rate of increase is striking. No other country has seen remotely comparable trends. If this trajectory continues, the UK will soon be among the highest spenders internationally, he said. Despite government plans to cut £4.8 billion from the welfare budget by 2030 through changes to disability benefits and universal credit, the Office for Budget Responsibility, OBR, forecasts spending will still climb to £72.3 billion by the decade's end. Mr. Waters stated that while these cuts will slow the rise in spending, they will not reverse it. The UK's situation contrasts with countries like Australia and the US, where disability claims have declined. Some experts suggest that financial pressures post-lockdown may have encouraged more people to claim benefits, which in the UK are not means-tested and are available regardless of employment status. In contrast, US disability benefits are linked to past earnings and contributions. Prime Minister Keir Starmer has prioritized moving people from benefits into employment. However, the National Audit Office, NAO, has warned that a shortage of work coaches in job centres could hinder Labour's efforts. Job centres have struggled to meet demand, leading 57% to reduce support between September 2023 and November 2024. Liz Kendall, Work and Pensions Secretary, has pledged to deploy 1,000 new work coaches to provide intensive employment support for disabled and sick claimants. However, the NAO reports a shortfall of 2,100 coaches needed to meet current demand. NAO head Gareth Davies emphasized the importance of effective job centre support in reducing economic inactivity and improving productivity. He called for transparency in evaluating employment programs to ensure their success. Stay updated on this and other political developments. Subscribe now for the latest insights and expert analysis on UK border policies.